Dean Russell.
Thank you, Chair, and thank you, Secretary of State, for attending today. My question builds on data and the importance and the role of technology over the course of the pandemic. It seems to me that we quite rightly are talking about positive aspects of the vaccines and the testing, but actually data seems to have been at the very heart of much of the work we've done. And I wondered if you could explain what lessons we've learned over the course of the past year or so in terms of the growth of how we've used data and how we've collected data to save people's lives.
Well, we have used data, I think, better in the health and care system over the last year than ever before. And we've proven the point that you need high quality, rigorous use of data and data architecture that protects privacy to make sure that people can be reassured that some of the conspiracy theories are just that, whilst making sure that you can improve care. And really the proof point of this argument is the success of the vaccination programme. Both its operational success, because we drew up a very high quality data architecture right at the start, learning the lessons that we'd learned during the crisis, but also in terms of how that's then applied on the ground. We use data to be able to target groups who need an offer of a vaccine brought closer to home, for instance, to make sure that they get the opportunity to have a vaccine and the opportunity to consent to do that. So that's just one example of how this has improved, but there's so far to go for the NHS to really get the value out of the data that it holds.
And can I ask, actually, outside of a pandemic, obviously moving forward, we've got a real rich sense of data, and I think that the country's got used to dashboards now in a way that perhaps a year and a half they wouldn't have even considered.
Yeah.
You know, from the daily briefings and from what the public can interrogate.
Yeah.
How do you see that playing out moving forward outside of the pandemic? Do you think that sort of information will continue to be available?
Well, I think there's huge strides forward that we've made that we've got to keep pushing on. So, for instance, using data for research purposes so that we can get new treatments and find them and get them fast to people. Using data to make sure that we can better manage things and have better coordinated delivery of care, for instance. Using data so we can take preventative action to stop people getting ill in the first place. I mean, we're going to launch a data strategy for the department that will set all this out in detail. But we've made in the next few weeks. We've made big strides, but there's a lot further to go.
And so would you say then moving forward, and especially a lesson from the pandemic, that actually data is going to be at the heart of the NHS moving forward? Would that be? I
very much hope so. The opportunities here are huge.
Yeah.
There are opportunities to save lives, opportunities to improve care, opportunities for the UK to be at the forefront of research. Just one small example before we move on. The recovery trial, based out of Oxford University, led to the discovery that dexamethasone could save lives from COVID. Over 1 million people are alive today who would have died. That's the latest estimate because of that discovery, based on high quality NHS data in the recovery clinical trial. I think that is a really good example of the sort of thing we can do if we get this right.
And from a personal perspective, in terms of one's own health data, so many people now wear Apple Watches. They track everything with their apps and their phones and so on. It seems to me that in the 20th and 19th century, people donated organs. There's an opportunity moving forward to save other people's lives. There's an opportunity to save more lives by donating data effectively, anonymously and securely.
Yes.
Do you see that as being part of that ability to potentially find cures for cancer?
Yes, of course. I think that my view is that every citizen should allow their data to be used, as you say, anonymously and carefully for research purposes. I think, and we've seen that happen during COVID, and huge numbers of people came forward and signed up for that approach. And I think it's something we can learn. In fact, what I'd say is that the public as a whole in the UK, everybody across the UK, has got far more used to dealing with data and their health data in particular. The final thing I'll say on this, because I know you want to move on, Chair, is that the data on your personal health, your health record, in my view, that belongs emphatically to you. It doesn't belong to your GP, it doesn't belong to the NHS, that is your data. so that people should be able to care for you based on that data. And if you want it to be used for research purposes, that's your decision.
May I ask one very small question, if I may? It just relates to when we look at organisations like Apple that are excellent at collecting data and have the tools and facilities to do that. Do you see an opportunity to sort of partner more with those sorts of big organisations who are already tracking people's heartbeats and say, look, could we find a way to help that improve people's health as well?
Well, up to a point, but what really matters here is that we can maintain people's trust and consent in the process. Personally, I'd be very happy to do that. But we need to bring people with us on this one.
Thank you.
Thank you. I think you may find that predecessor health secretary have the same view about who owns your personal data.